Lab chat, lab chat, lab chat.
Thank you for tuning in to CAMLT Lab Chat. CAMLT is the California Association for Medical Laboratory Technology. It enhances clinical laboratory professionals through public policy, advocacy, education, and member services. Today, we have an interview with the founder of the CAMLT Lab Chat, Adam.
Hello, thanks for having me.
Awesome. Thank you so much for giving us your time. Adam, can you please tell us about yourself and your CLS career?
Sure, yeah. Well, I guess it all started back in, I attended Cal Poly San Luis Obispo and was a microbiology major there. And I was lucky enough to actually interact with our now president, Valerie, as she's the Central Coast chapter. She's a big mover and shaker down there. And so she would frequently visit the campus. And so I remember being kind of enticed into the CLS career through her, actually. And there were several other people who took time to visit our campus. So I definitely believe that that's a big part about our duty, now as CLSs is going and reaching out to colleges, because this isn't a career that people oftentimes think of. So I'm really grateful for those mentors that I had getting me in. And I did my internship down at UCSD and at the Center for Advanced Laboratory Medicine. And it was just an awesome program, awesome people that ran it. And I really got a solid foundation there. And then I went on to work in several hospitals in the San Diego area. Then I took a job in biotech in San Francisco and worked there for 2 years, kind of to get more of an idea of what it takes to actually develop a lab test and all of the inner workings of basically establishing a brand new lab. So I was really lucky and got a ton of experience doing that. And now I took a job in my hometown at a hospital and just loving that as well and getting back to my microbiology roots. So I get to work half of the time in microbiology and half of the time in general lab, which I love.
Wow, Adam, that is a lot of experience. That's just amazing. So you've been talking about microbiology and how that caught your eye, and that's basically what got you started into the clinical laboratory
hmm
scientist field. Please tell me, what about microbiology or what department in the laboratory interests you the most?
Oh, that's a really good question. I've always liked microbiology because it's something that you never know what's going to happen. So it's kind of like that mystery game of, well, what's going to grow tomorrow? And I think that's really interesting. A, that we can't see, these organisms, but B, that they do end up growing on a plate and we can actually visualize them and we can use, microscopes to view them. So I think that's, my fascination with microbiology is kind of the unknown there. But I also love hematology, um, looking at different blood cells and seeing how they kind of fit into their families. And I'd say pretty much anything with a microscope in the lab I'm drawn to.
I agree with you. The
hmm
fascination of microbiology is definitely the same thing that drew me in as
hmm
well. And, articulating the microscope, that's just so interesting to me. In addition to that, what was the most mind blowing lab situation you've ever had?
Ooh, that's a really good one. Um, I can recall a couple of times. One of them actually is kind of just was really important, I guess, in another way. It wasn't an actual patient, but it was on cap specimen that we had at one of the first hospitals I worked at. And it was a Loa Loa, microfilaria worm. But we failed that competency. And the main thing that happened is the techs that reviewed it didn't look at the smear on low power. And it's kind of not something that we're in the rhythm doing as hematologists in the first world, because we don't see, large parasites, but it just so happened on the thick part of that smear that there was a microfilarial worm. So I think that was a good reminder of, why taking your time and doing the things that we do, is very important in the lab.
Wow, yes. To have a Lolo right in your eye and not even see it.
Yeah, exactly. I mean, how do you miss it, right? It's one of those things where you think, how could you ever miss it? But there were several techs who, on review, had no idea. So it's just a really humbling example of, why we do things the way we do, and those things can happen if we're not careful.
Definitely. That is the masterpiece of the profession that we chose
Mm-hmm.
as clinical laboratory scientists. In
Mm-hmm.
closing, what, if any, advice would you have for new laboratory scientists?
That's a great question, and one I'm continuing to ask myself just going forward is, what can we do in the profession to, one of the things I'm constantly reminded of is, the risk of burnout in our profession, along with other healthcare professions. And I think it's really important that we just kind of remind ourselves the value of our work. I think to a young tech, it's easy to, lose sight of what you're doing because you're out of money. I had $500 in my bank account when I graduated, so I wanted to make a lot of money. And I think when you're motivated by money, you lose that passion and you lose sight of why you got into the profession. And so I think, the advice would be to never lose that passion. And if you feel like you are losing that passion, go back to your roots and figure out why you got into it in the first place. One thing I do is I go down to Haiti every year, and I work in a clinic down there with one of my good friends who I met back in my early hospital days. And it just really is the basis of lab medicine. And I got to work this year with a Haitian lab tech, and just seeing, how little they have, and what we can actually do just with such limited resources, and how it helps, this population is incredible. And working together as a cohesive healthcare unit in a third world country has really, just opened my eyes. And so I think that's really important, is just going back to why you got in the profession in the first place, and valuing every day and staying humble.
Wow, Adam, that is just a tremendous statement. And I will keep that near and dear to my heart as well, because the passion, you have to work with your heart, you have passion for something, especially something so complex. And they definitely thank you for your service going to Haiti and working with people who don't have much. That's just amazing. I definitely want
Absolutely.
to thank you for your time. This has been a very just awesome interview. And hopefully we can tune in to your Lab Chat podcast. For all of you listening, if you can't watch a video, definitely tune in on the podcast, CAMLT Lab Chat. Also, check out CAMLT online and join as a member if you're a laboratory professional. Thank you again, Adam.
Awesome. Thank you so much.
You're welcome.
Bye-bye.
Lab chat, lab chat, lab chat.